I was interested in changing jobs and I realized that I wanted to continue my education in some capacity. I thought that that would help me determine what type of job I was looking for. And of course, I thought that would strengthen my resume. Going back to college for a master's degree was not financially feasible for me at the time, but with the internet and everything, you don't have to limit your education just to colleges and degree programs. So I did some Googling, like what type of epidemiology course could I take that would kind of strengthen what I'd learned during my degree, that would kind of show potential employers like I'm a lifelong learner. I will find a way to learn new things and to, continue adding value wherever I am, even if that means, taking an online course, even if that means I can't go back and get my MPH immediately.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about how to make an impact in growing your public health career with a bachelor's degree, transitioning into healthcare from a more traditional public health role, and how to intentionally upskill to be a qualified candidate in doing so, as well as the importance of focusing on your personal mission and not so much on specific rules, and how that can be helpful in your career journey. If you enjoyed today's content, all I ask is that you hit that subscribe button, leave a review, and share this with someone who gets some value from it. If you're watching this on YouTube, be sure to hit that like too. This is really the best way to support the show getting out to more people. So be sure to subscribe, leave a review, and share it with someone who gets some value from it. Thank you so much. Enjoy the show.
Hi, everyone. I'm Marissa Leahy. I'm an infection preventionist at Jefferson Health, and you're listening to the Public Health Careers podcast.
Today, we have an enthusiastic professional who transitioned from public health to healthcare epidemiology. She conferred a Bachelors of Science in Public Health at Drexel University Dornsife School of Public Health, and she currently works as an Infection Control Practitioner at Thomas Jefferson University Hospital. We have Marissa Leahy, BS. Welcome to the show.
Thanks for having me, Amari. I'm excited to be here.
I'm excited to hear more about your story. So thank you for making some time to be with us today and share more about your experiences and your stories with us.
Absolutely.
So how do you identify, and tell us a little bit about your personal background?
Sure. I'm Marissa Leahy. I use she and her pronouns. I'm a white person with mostly Irish and Italian ancestry. I was born and raised in the city of Philadelphia, where I still currently live. So my whole educational and career journey has all occurred in Philadelphia, which I'm extremely thankful for. I'm also a first generation college graduate. So my parents, grandparents, etc., did not receive college degrees.
Well, I appreciate you sharing a bit about that background and your history and where you're from, Philadelphia. In the intro earlier, I shared that you transitioned from public health into healthcare epidemiology. And I know that you have some information and insights on for public health professionals who are thinking about pivoting their career into healthcare or other industries outside of like public health, traditionally speaking. So what kind of insights and advice do you give around that?
Absolutely. So one of the first things I could say is it's great to demonstrate to any career pivot that you are a lifelong learner. So for me specifically, what I think helped me pivot was taking a course online and kind of learning more outside of my bachelor's degree, outside of returning to college for a master's degree. So I think the pivot, was strengthened with the educational experience, also with just being flexible, being open. When I was in college, I never thought that I would work in healthcare. In fact, I would say I'm never going to work in healthcare. I refuse. It's too bureaucratic, it's too big, I wouldn't like it. But having an open mind, being flexible, allowing your plans to change. I think those things, of course, coupled with continuing your education in any capacity, whether that's formal or informal, I think those are great tips for someone who wants to pivot.
Thank you for sharing that, and I look forward to jumping more into that. But I think like that's important perspectives for anyone, whether you're in public health or you're trying to transition into public health or transition out of a traditional public health role. Is like just being a lifelong learner, being flexible, and kind of just embracing the unknown and working and leaning along in that space. And
Absolutely.
in the same vein as above, if you had one piece of advice that you had to give to a public health professional around developing themselves in the workforce, what type of advice would you give them? Or what's that one piece of advice you'd give them?
Sure. So the best advice I could give for fledgling professionals is to stay attached to your mission, whatever that is. And, of course, accepting that your mission may change as you learn more and grow. So attach yourself to your mission and don't attach yourself to one organization, one employer, one school. I think so often we idealize certain institutions, whether that be a school, employer, or otherwise, and we kind of lose sight of the direction we intended to go in the first place because we're concerned about the notoriety of the school, what other people will think, how prestigious the institution or the employer, etc. So I would encourage professionals to keep your mission close to you at all times and understand sometimes that means moving on from certain opportunities. Or sometimes that means plan A doesn't work out, so you enthusiastically go into plan B.
Absolutely, and I love the point of like developing a mission as well as missions can change, especially in public health, especially as you're a lifelong learner. Like as you develop more knowledge, your perspective of the world and how you can impact it should change, and with that, your mission may change. But I think really, as you're saying, there's like sticking to your values, sticking to the things that interest you, and building off of that. And for someone that is thinking about developing their mission in public health, well, how would you go about thinking about, okay, what is my mission and how should I think about my mission as a public health practitioner?
Absolutely. So for me, what that looked like was reconnecting with childhood. When I was a very young girl, I was so interested in diseases, and I had the Fever 1792 book. Um, I was just fascinated with diseases and how they moved through populations from a very young age. Now, that may not be everyone's story, right? Not everyone has a career passion as a child. But I think if I would have just kept that small fact about myself in mind throughout my college career, I would have found public health much sooner. So I would say, if possible, look back a little bit. What were your interests or what inspired you to get into this field? Did you have an experience? Did something good happen to you or bad happen to you that led you, to want to contribute in this field? Go back to that. Keep it simple. It doesn't always have to be like lofty dreams or extremely specific goals that we have. Some people, they're interested in, you know, clean water and wash and things of that nature. Some people are more interested in violence prevention, injury prevention. Just think about your why and just don't make it too complicated. There's space for you in this field, most likely to do with your, niche interest.
Absolutely, and I couldn't agree with that more. And public health has so much to offer you, and I think like in that point, it's like really understanding like what is your why, because there's so many ways to impact health and to do work in public health or in healthcare, and really understanding. I love that you put it like many times we take for granted those things that we enjoyed as children are the things that we can still find like joy from and develop a career around. And it's not often times where you can develop a career around something that you're like genuinely interested in and like you just love to lean. So it is always like some sort of a blessing when
We're
that kind of
lucky to
happens,
be
right?
here. Yeah.
Right. Exactly. Okay, so you gave us a lot of context there. Before we get more into your public health collegiate journey, what does public health mean to you?
Yeah. So public health to me means access along with acceptability. So, of course, when we think of public health, we think of population level systems, interventions, programs. And we want the general population, everyone, regardless of socioeconomic status and whatnot, to have access to those things. We want people to have access to healthy food, clean water, a space to work out, etc. What I think sometimes gets lost, and of course our field has been working on this, is the acceptability piece. Is the targeted population going to be okay with this? Are they going to want this system, this program, this service? Do they want to participate? Because we can funnel as many dollars as we want and hire all the smart project managers. If the people that this is intended for won't accept it, what was the point? So I think not only access to healthcare, healthy communities, everything of that nature, but also tailoring it to the people that we're intending it for so that they accept it and, get the most benefit out of it.
Yeah, absolutely. And to that point is like we could have intentions about many things, but really, in order to get to a place where we're making positive improvements in health, it is really focusing on what are those populations, what do they need, and what are the things from their perspective, and how can we engage them throughout that process. So I appreciate you sharing that.
Absolutely.
You got your Bachelors of Science in Public Health at Drexel University Dornsife School of Public Health.
Yes.
Tell us about that thought process and going into school. Did you go into school as a public health major, or what was that thought process like for you?
Yeah. So I applied to Drexel as an engineering major, and I was so excited about that. So the reason that I went into school as an engineering major was basically my high school science and math teachers encouraged me to do so. I went to an all girls Catholic high school in Philadelphia, and they were very focused on women in the hard sciences, if you will, women becoming chemists, biologists, engineers. I was good at science and math, always got good grades. And so I thought science plus math equals engineering. So I went to engineering school. It was extremely difficult for me, which was not something that I was used to academically. I mean, of course, high school to college is a transition, but you know, high school to engineering school was quite a transition. So I realized that engineering was not for me in a couple ways. One of them was I wasn't performing well academically. I actually failed a class, which is something I never thought would happen, but here we are. So I failed a class. I wasn't really getting along with a lot of the people. I mean, like, we weren't fighting, but I just wasn't making a lot of friends. And usually that's not hard for me. And then I watched a movie. So I watched the movie Contagion with Kate Winslet, and that changed everything for me. So I watched that movie, and for those of you who aren't familiar, it's basically about a SARS pandemic, oddly enough. And Kate Winslet is the main character, and she's in like the CDC Epidemic Intelligence Service, where she's like out there, investigating this outbreak, this pandemic as it's unraveling. So when I saw like the badassery that was Kate Winslet, I was like, I want to do that. Whatever that is, sign me up. I'm not happy in my current major. I want something different. And she's working with diseases. That's what I want. So I went to my academic advisor and I said, I watched a movie. I would like to switch majors. And she was a little hesitant at first, but once I explained it to her, that like I was kind of pushed into engineering school and I thought that I could make engineering and diseases kind of work together. Like, oh, maybe I'll bioengineer some vaccines, or I wasn't really sure, but I was like, I need to do engineering because I'm smart or whatever. And I'll somehow connect it back to that little childhood interest that I mentioned. But, somehow, some way I'll connect the two. But then I realized, no, I could just pursue that. So after a few discussions with me, she agreed that this was a good move for me. She believed in me. And I was able to switch my classes and switch majors to public health. I minored in sociology as well. So I was taking, of course, public health courses, science and math still, and then quite a few sociology electives, which was really exciting to me, the people side of things. So yeah, that was kind of my college journey in a nutshell. So freshman year was engineering, and then from then on out, I was a public health major.
That makes sense, and I would imagine that someone, or at least an advisor, would listen to you and say, "Hey, I watched this movie. I want to switch my major," and they'd be like, "Oh no, that's a
Yeah,
bad idea."
yeah,
But I think like going a little deeper into that is like figuring out the reasons, like just lining that back up to your childhood interest, and then actually seeing that there's a career around this from this movie. And I think like that's one of the good things about about that movie, as well as about the pandemic, unfortunately, is that it just shined a light on public health as a field and public health as a career that you can do. And though like of course it was mostly focused on epidemiology, there are so many things that you can do in public health. And I think just being able to get exposed to that in whatever way, whether that's through contagion or whether that's through a health education class, is just so important that we are able to get those experiences and really like just form the ideas and move forward in the ways that we think we can work and do work that's positively impacting communities. So I appreciate you sharing that, and I'm glad that your advisor went along with you once they fully understood that you weren't just doing this because you saw a movie for no reason, but there was like direction and a thought process behind it.
right. And you know what? She actually told me, like later down the line, that she used my story to kind of talk to other students. She was like, whatever the reason is, it's likely really valid. You've thought about it. This is your life and your career after all. So she told me that she would actually tell other students. Like, I had a student come to me who watched a movie and changed her major. Like, whatever your story is, you own it, it's valid.
It is valid. Just make sure that you really dive in deep and saying, okay, this is something I want to do, and like I have my reasons behind that, and really being able to back it up and justify it. But yeah, shout out to you for being that story, and hopefully
Thanks.
here you are continuing that story and helping other people to realize that I can do this because I watched this one film or I read this one book and they are doing some cool work, and I want to do more of that. So I appreciate you sharing that.
Absolutely.
And during your time during your bachelor's degree, you were a summer research institute fellow at the Food Trust. So tell us a little bit about that experience.
Absolutely. So, if you're not familiar with Drexel University, they offer a co op program where you can actually work during school, which was invaluable to me because I just couldn't wait to get my hands dirty. So, for my co op over a summer term, I was a summer research institute fellow for the Food Trust. And the Food Trust is an organization here in Philadelphia that promotes access to healthy food across the city, particularly in our food desert areas. So we have quite a few zip codes in the city of Philadelphia, unfortunately, who don't have readily available access to healthy, fresh foods from grocery stores. What we do have in some of these more underserved areas, and this may be true in other larger cities as well, we have a lot of corner stores where they offer snacks and drinks. Some of them do also offer, produce and whatnot. A lot of that has to do with the food trust implementing those programs. And a lot of times they do cooked food as well, cooked breakfast, lunch, dinner, that type of thing. So through this program, I was teamed up with some like minded students and we did surveys outside of these corner stores. So they kind of used us summer interns as a way to gauge how well their program was working. So we surveyed outside of corner stores that had no intervention. And we also surveyed outside of corner stores where the food trust had their program implemented. So they would ensure that there was like more space for water versus soda in these stores. They would ensure that there were a certain amount of fresh produce items available for customers. So what we did, we stood outside the store and we tried to get customers to take a survey, and we had an incentive of a SEPTA token, which back in the day was like a coin that you would use to get on public transit in Philly. So we found that people did enjoy the programs that were put into their local stores and that they did purchase the produce. They wanted these programs to continue and they were happy to support them. We also found that, you know, I mean, we didn't invent this idea, but that these stores were people's main access point for food. So instead of trying to, tear down the whole system and think of how we can rebuild it, it was kind of just like, the food trust decided to bring what was missing from these areas to the existing stores. So we got to interact with, of course, the customers of the store, just community members passing by. also the store owners, which was a unique perspective as well. At the time, this was, I want to say, around 2017, the Philadelphia soda tax was just being implemented. So taxes on sugar sweetened beverages, including soda, were increasing. And the thought was it would deter people from buying them as much. And then the money that they did gain from the taxes, the city would use for daycare programs. So that experience at the food trust, it was invaluable to me because it was my first experience working in the field. I feel like so much of public health is theoretical, academic-y, and for some people that works. Some of us are more practical and kind of just want to, like I said, get our hands dirty. So I was really excited to be out in the field for the first time, and this internship allowed me that opportunity. I'm familiar with the city, but the city of Philadelphia, it's very segregated. I mean, like, we're like a city of neighborhoods. So it's kind of like you stay in your neighborhood, you usually don't really leave. So I got to interact with communities that I'm usually not in on a day-to-day basis. So I got to learn, how to get around the different streets, interact with the people. And, that really set me up, I think, to be like a confident field worker because my next position was primarily in the field. So that internship was invaluable to me.
Well, I'm glad you got to do that experience and like just being able to be in the grassroots, being able to talk with people and interact with them and just getting their perceptions of the things that you're doing or the things that you aren't doing, to see if there is that need and people do want this, and just understanding that there are so many ways to impact community, but we really do have to start with meeting the community where they're at, understanding what their thoughts are and moving from there. And it's awesome that you were able to get that on the ground experience and work while you were in your undergrad program as well. And shout out to that soda tax, and hopefully those taxes are being used well for those
Eh,
daycares and public
that's
good.
up
Because
in the
I
air.
right, right, it's better than nothing, though. Better than
Right.
nothing. So we'll take it. A small win for public health for sure. And tell me more about so after watching Contagion, did you know the word for public health? Sorry, I actually have not seen the movie, so
Mhm.
so I'm not familiar with it. But is that something that you learned the word for public health, or you learned the word for epidemiology, or what was that thought process and like that conversation that you had? I'm guessing previously.
Absolutely. So I would say that introduced me to the concept of epidemiology, but I didn't quite connect the umbrella term of public health until I kind of Googled epidemiology. And then I was like, this epidemiology, this is everything I've ever wanted. So yeah, I mean, the movie definitely introduced me to the concept not only of epidemiology, but also field epidemiology, right? Because, some epidemiologists primarily work, remotely on their software. And then there's field epidemiologists who are kind of out chasing things. So I think I was also fascinated with the concept of field epidemiology, like literally chasing the disease out in the world. I just thought that was so cool.
Yeah, and that's important perspective to get, because yeah, many times we do think of like epidemiologists in this one way behind a computer cranking out numbers and data behind a computer, but many times they are, as you said, like field epidemiologists, people that are on the ground meeting with community and doing different epidemiological studies, etc. with communities, which I think is important. And tell me about so you said you got a minor in sociology. How did that part of your degree come up?
Yeah, so it was a requirement for public health majors to do social science electives. And I had a multitude of courses available to me, but the ones that stuck out to me the most were these sociology courses. Just to name a few, I took sociology of the family, sociology of disasters, gender and sexuality, courses like that. So I realized that, well, my advisor, who, helped me switch into the major, she helped me discover that I was only a couple credits away from naming this minor. So I kind of like fell into it. And she was like, look, if you take like one more course, that's enough credits for this minor. And I was like, oh, that's great. I think that represents me well. with my interest in the people side of things as well. Because again, I was so pressured into the science side of things in my earlier career, coming out of high school, that in some ways I was hesitant to explore my interest in people, you know, and even at the food trust, we had a whole crash course on urban anthropology, and my mind was blown. I was so fascinated, putting academic words to concepts that I was familiar with through being a lifelong citizen of Philadelphia.
That's important as well. I think like just understanding that like we see a lot of things in this world, but we don't have the words to describe it. But public health many times, especially with us in these fields of like working to improve people's health or population's health, is that there are words out there. It's just trying to like get to those words and understand that there are things. And shout out to school and Drexel for being able to help you in understanding all the different ways that you can do public health, as well as I guess contagion, which was an important part of your journey as well.
Yes, shout out Kate Winslet. You inspired me.
Love it, love it. And did you have any undergrad takeaways that you wanted to share before we move on to your positions after undergrad?
Yes. So my undergrad takeaway that I would love to share with the current students is undergrad is practice for the professional world. Whether for you that means a job, internship, fellowship, grad school, whatever that means for you, undergrad is practice for that. Things as simple as meeting deadlines, showing up on time, being respectful in discourse, engagement, disagreement. I think sometimes college students get so laser focused on their degree pathway, on their academics, that they might not realize like this is, again, practice for the professional world, however you define that. So I think no matter what type of college degree someone has, like if I see someone has a degree, I can kind of assume certain things about them. They can meet deadlines. They can work collaboratively, because unfortunately group projects that you have in college, it's real in real life. Even remote workers collaborate on group projects. So, taking the time not only to, enjoy yourself for one, have fun, make friends, pursue your passion, do well in school, but also kind of take what you can get from that experience and apply it to the professional world. I think one of the most useful classes I took in college was not a public health course. It was business communications. And our professor talked a lot about what's acceptable in the workplace and what's not. And, especially for my first generation college students, first generation college graduates, you may not have parents and family members at home who just teach you how corporate America works, or teach you how to be a good employee, in the professional world. So when you have the opportunity in undergrad to learn what it's like out in the world and to demonstrate those skills, again, meeting deadlines, showing up on time, being respectful, take those opportunities, because those will be useful. Maybe chapter 10 in your course might not show up in the professional world, but for sure, meeting deadlines, collaborating, being respectful, those things will for sure come up.
Very, very important. And I think highlighting that part around their professionalism, because I know many times we don't know what it looks like to actually go into a workplace and like dress properly or like speak to people or just interact with people. But yeah, I appreciate you sharing that, and really tying those things that you are doing throughout your undergrad or like any degree to really focusing, how does this relate to my professional and career aspirations, and how is this important to that? So after you graduated, you became a disease intervention specialist at the City of Philadelphia Department of Public Health. So tell us about that thought process, or how do you come across it, and then what do you do in that position?
Absolutely. So before I tell you the riveting details of me working as a disease intervention specialist, I want to kind of back it up a little bit. So I worked at a restaurant while I was in college, and it took me 9 months after my graduation with my bachelor's degree to land that job. So I think it's important to kind of highlight that to the listeners, because I think sometimes we have this idea of how things are supposed to go, what we're entitled to receive if we have a degree. And I'm here to tell you that it doesn't always work out that way, and that is fine. And I worked at one of the best restaurants in Philadelphia. It's called Zahav. It's Israeli cuisine. It's absolutely phenomenal. If you ever have the chance to check it out, please do. But there were times when I was working at the restaurant and I had my degree and I felt bad about myself. I felt like I would never succeed. I was sending application after application, getting rejection after rejection. And I was wondering, did I just get that degree and do these internships and do these extra things just to work in this restaurant forever? And of course, I have nothing against restaurant work. I love restaurants and nothing but respect to everyone in the service industry. But so that's kind of the background before I became a disease intervention specialist. Is I did not have a professional public health job right out of college. So I'll just be honest about that. But how I found that, so I was sending out a bunch of applications, and of course I was looking up Philadelphia Department of Public Health, because when I was in college, it was my absolute dream to work for the Philadelphia Department of Public Health, PDPH. So when I saw that they had a position open and that it was to do with sexual health, I was like, sign me up. So I applied, and it took a while for them to get back to me. And I was thinking, this isn't going to work out. Like, they're just either going to ghost my application or I'm going to get rejected. And I was actually looking for another restaurant job. So I went to an interview at a different restaurant just to change things up. As I'm waiting for the bus to leave that interview, I got a call asking if I was still interested. And I was like, yes, of course. I was like, they didn't know what situation I was in. So they brought me in for an interview and then a second round interview. And luckily I was able to land that position. So a disease intervention specialist, what that entails is intervening in the course of disease, trying to stop it in its tracks. Some health departments will have disease intervention specialists work on a variety of things like STDs, hepatitis, all types of communicable diseases, but my position was specific to STDs. So I mainly worked with patients with syphilis or HIV diagnoses. So what I did at my job, I connected individuals to treatment for sexually transmitted infections. And then the second piece was I provided partner services. So what partner services is a disease prevention tool that we use to try to, break the chain of infections, particularly syphilis. We did partner services for HIV, new HIV cases as well. But most of our volume here was syphilis. So the individual would get treated either at the city Health Center 1 in South Philly, or at their primary doctor, whichever they preferred. And then we would do a partner services interview. So what that basically means is I would extract details from people about their sexual contacts to then follow up with the sexual contacts with the utmost confidentiality, of course, because we can't violate HIPAA, nor do we want to, and encourage those sexual contacts to get testing and treatment for syphilis. So the idea was someone tested positive for syphilis. I would explain the importance of partner services and how, if your sex partner doesn't get treated, they could give you this infection again, and then you need to get treated again with a long needle that's not comfortable. So, and as you can imagine, that was challenging, right? Some people are more willing to share, other people were absolutely not about it. And, working through those barriers, we were the government. Not everyone wanted to talk to the government. I mean, I was in plain clothes and everything. I drove my own car. I was very discreet. But once I identified myself as Marissa from the health department, some people were automatically turned off, understandably so. We would try to work through those barriers, though. Like, what is your concern with speaking to me? Like, why don't you want to speak to me? What's the reason? And we would try to address those concerns so that we could try to have a successful interview. Because really, the goal here was to ensure this person's infection would be treated, especially syphilis, it would be treated, and then they wouldn't get it again, is the goal. So, getting their partners tested and treated was paramount to try to break that chain of infection. That process looked slightly different for individuals with a new case of HIV. So we would connect them to care. We would make sure that they had, a primary doctor to go to. We would team up with our social work team at the health center to ensure that other needs were addressed. How can you take a pill every day for an HIV infection if your housing is unstable, etc. So social work, really came through and helped us out with that. We would also do partner services for HIV cases, and we would, try to follow up with their partners to encourage testing. And, the way that we would follow up with these people, all different types of ways of contacting them: phone call, email if we had it, messages on Instagram if we could. Any way to try to contact these people and let them know that, they would benefit from STD testing and treatment. And, I've had some really memorable clients, like in the best way, like the sweetest people. They were really appreciative. And we had great conversations even outside of just my purpose of contacting them. Also had some clients that were memorable for other reasons, but regardless, this experience really set me up, I think, to just take off in this field. I feel like and shout out to any DIS listening to this, by the way, keep killing it. But I think if you can see a client or a patient, however you want to refer to these people, if you can see them through from the point of, shock, confusion, shame, whatever they may be working through with a diagnosis of an STI, and, some people, it doesn't affect them negatively, but for the people that it does, seeing them through that to treatment, through partner services, additional follow-up, I really got to know a lot of people. And I learned so much about the communities that we worked with, how unique a lot of them are, but in a lot of ways, how, the need is kind of the same for some people. Like a lot of people just didn't have access to primary care, or they didn't have access to like a reliable pharmacy, or, their job or other things in their lives were so demanding that taking care of themselves wasn't really top priority. But, when we visited them, like, you're my priority. I'm knocking on your door trying to, get you to come in my car to take you to get syphilis treatment. You're the only thing on my mind today, sir. So, that job was just incredible. I did it for about 2 years. It was the best experience. It's a great job for starting out in public health, especially. So if anyone is graduating soon and isn't sure about jobs in their area, look into disease intervention specialists. A lot of smaller counties will have their DIS do STD and other infections, but in larger jurisdictions like Philadelphia, we were an entire team of people just focused on syphilis and HIV. We had another team focused on gonorrhea and chlamydia.
I appreciate the insights, and I think great insights. Like just for anyone that might know what they want to do, I think it's, as you said, it's a good way to get out into the community, to meet people, to hear about, to just have those conversations with people that you're trying to work with and improve their health, and just understand where they're coming from, understand like what has their life experiences been like, and educate them and try to give them resources to help them. And I think you named a very important thing of like trust. It's like many times you can come in, especially as a Department of Public Health or any kind of other health agency, and there's already a stereotype or stigma that comes with that organization. It's like we need to show people that we are people just like them, and we are just trying to do our best to work with them to improve their health and move forward on things, which I think is really, really key.
Thank you.
And I wanted to ask, I also appreciate you sharing about the 7 months of working at the restaurant as part of your journey, because I think that's very, very important. And I wanted to dig a little deeper onto that. So let's say that someone has graduated from their bachelor's program, their MPH, their PhD program, and they're struggling to get a job. And you said that you were constantly applying, and I know especially with a lot of government jobs, you mightn't hear back for months, unfortunately. So shout out to them for calling you while they're on the bus. But how did you stay motivated and inspired, and or how would you advise others to stay motivated and inspired during that time?
Sure. I think a big part of it is not giving up on myself. And I would encourage anyone in a similar situation, whether that's just starting out or pivoting into something else, don't give up on yourself, on your mission. There were late nights, early mornings where I just didn't feel great. I didn't feel motivated. I was like, let me just get through the shift at the restaurant. I'll go to the coffee shop before work and send some applications out. So I think I believed in myself the whole time. Even when I didn't believe in myself, I believed in myself, if that makes sense. Having to send out hundreds of applications, it's daunting. It really is. I got to the point I was applying to things I wasn't even that interested in. I just wanted a foot in the door in the professional world. So I'm a firm believer in if you work hard at your specific goal, you ask for help, you'll achieve it somehow, some way, even if it's not exactly how you imagined. Something else I would encourage the listeners, if they're in that situation, to do is to reach out for help. What about your friend who graduated a year earlier? What about your cousin who has a professional career, maybe not in public health, but has been through this before? Who can you lean on to support you? Because you don't have to be all alone. And I think that message especially goes out to my first generation people. Who has done this before you? Who can you reach out to for advice? There have been conversations that I've had with people smarter and more experienced than I that it feels like that conversation alone leveled me up 10 points just from gaining someone else's perspective or just from someone saying, keep going. So don't isolate yourself, believe in yourself, and ask for help and reach out to your network, even if that's just friends or family.
If you need some belief, me and Marissa believe in you. So just
Yes.
remember that you can do this no matter where you are, but just keep on persevering because you will get to where you need to get to, as well as that importance of leaning on the relationships that you have that you may have like not nurtured as much as possible, but people are always there, and people, especially these days, they're just a phone call away, a text away, a LinkedIn or Instagram message away. Just reach out because you never know who is going to be the person that can help you or connect you to someone or inspire you or like level up your career, as Marissa shared. So appreciate that. Great advice. And
Sure.
yeah, just keep on trotting on. And you're also a prison liaison for the city of Philadelphia Department of
Yes.
Public Health. So tell me about that experience and what you did in it.
Sure. So once I had a bit of experience under my belt as a disease intervention specialist at DIS, I was asked to be our prison liaison. So the Philadelphia Department of Public Health had a partnership with the Philadelphia Department of Prisons, and we identified quite a few new cases of syphilis and HIV through intake screening at the prison. So the main prison facility, the main intake facility is called CFCF, the Curran from Hold Correctional Facility. That's where most of my work happened. So what did I do as a prison liaison? I went into the prisons and I did partner services interviews with the inmates there. So that was mostly men's jail, but there was also a women's jail. I went to both. And I would speak with the prison nursing staff to ensure that the patients did receive their treatment. And then I would speak to them regarding their partners. That was always interesting because I would be trying to follow up with partners on the outside. And then I would, of course, follow up and do repeated interviews and sessions with the inmates on the inside. So those were kind of like unique cases to trace. So I would go to the prisons about once a week. I would spend the entire day in the prison. So I would have a locker to put all my personal items. I couldn't bring my phone into the prison. And it's not as like locked down as you might expect if you're not familiar with prisons. And this is like, like a county jail type of thing. So it wasn't like a maximum security prison by any means. So I would walk in, and prior to the COVID pandemic, I would conduct my interviews in the medical area of the jail. So I would, go through security, get checked in at the jail, and then I would like walk down a hallway with like hundreds of inmates, just casually walking down the hallway. Like I got used to it after a while, but it was surely a eye-opening experience. I had never been into a jail before prior to that. So I worked with the nurses and the infection preventionist at the jail. So that's going to segue into something else later. And, we would ensure that these people on the inside were taken care of. I mean, the amount of cases that we identified was just astronomical. I mean, like, you are taken to the jail, and as part of your intake screening, they would, of course, do blood tests, and they would test you for both syphilis and HIV. For the syphilis cases, that's a bit more straightforward because syphilis is a bacterial infection that's curable with penicillin or doxycycline. For the new HIV cases, of course, we ensured that the inmates had access to infectious disease doctors on the inside, that they understood why they need to take their medication and the benefits that has for their health. And we would work with some really cool organizations, like Action Wellness, to name one, in Philadelphia, to ensure continuity of care when these individuals got out of prison. Because, I mean, the worst case scenario would be someone gets diagnosed with HIV in the prison, they're counseled, they get medication, they understand what's going on, just for them to be lost to follow up once they are released. So, shout out to Action Wellness. They do amazing work, ensuring that continuity of care, for a vulnerable population that's often overlooked, unfortunately.
That must have been quite an experience that you were able to get there.
Oh, I have
And
plenty of stories.
I could only imagine. I
Yeah.
could only imagine. But it's just like good for you to like mention this because someone might be thinking that they want to work in a prison and they might know how to get that prison and public health work like at that intersection. So just knowing that there are rules out there where you can do this work, and a lot of the times, as you said, they are very vulnerable and overlooked population, but they have very unique needs and things that ways that we need to support these populations. So I appreciate you highlighting that. And I know you alluded to learning about infection prevention, but we'll get into that a little bit later on.
Okay.
You got a certificate in phlebotomy, so
Yes.
tell me about the thought process of getting that certificate and maybe like some takeaways from it.
Sure. So the certificate in phlebotomy was actually through my disease intervention specialist job. So we had a course with a registered nurse, and she taught us how to draw blood out of someone's arm. And that was really exciting for me because I, of course, never pictured myself in healthcare or providing any sort of direct patient care. I never had the desire to be a nurse or a doctor or anything like that. But I was like, wow, like this is a tangible way for me to kind of provide some of these services, of course, not in the scope of having a license that a nurse or a doctor would have. So the course was really cool. The nurse who taught us, you could tell she was doing this for many years. She could probably stick someone with her eyes closed. But the purpose of me being certified in phlebotomy was to draw blood from STD patients either in our clinic or out in the field. So we called it a field blood at our department. So what that meant was if I encountered someone out in the field who was a contact to syphilis or a contact to HIV, someone who we're following up with them because we want them to get tested. If for some reason they refuse to come to the clinic, they can't make it, we would draw their blood in the field. So I have drawn people's blood in the front seat of my car. I'm in the driver's seat. Mr. Sir is in the passenger, and I'm drawing blood out of his arm. I've drawn blood in people's living rooms. I've drawn blood out on the street. I have my kit on my trunk and I'm drawing blood right next to it. Another interesting place that I've drawn blood is in the Kensington section of Philadelphia. If you aren't familiar, Kensington, it's an amazing neighborhood in a lot of ways, but it is home to one of the largest open air drug markets in the United States. There's a lot of heroin and fentanyl use happening on the street, visible in Kensington. So there's a lot of people who live there who are within active drug use. So there was an organization in Kensington, I don't remember the name, but they did ladies' night where they would have women come and get showers and, they can do their hair or makeup or, they had like a clothing closet where they could swap out and get fresh clothes. And we would attend ladies' night and we would offer gift cards as an incentive for individuals to get their blood drawn to test them for syphilis and HIV. So that posed a unique challenge for me as, someone who doesn't have formal nursing medical training drawing blood. Individuals who use injection drugs, sometimes their veins might be more difficult to access. So I had some really difficult sticks there. So I think that experience kind of really leveled up my ability to draw blood. But basically, yeah, we drew blood anywhere and everywhere. You won't come to the clinic, we'll bring the clinic to you. We of course didn't treat people in the field because we weren't qualified to do that. But we could for sure test them in the field. And then, okay, you can't come to the clinic, I'll draw your blood, I'll drive it down to the public health lab, and then in our medical record system, I could monitor their chart for the results. Once the results would come back, I would give them a call. I mean, of course, certain sensitive results like HIV positivity, we couldn't discuss that over the phone. But if they had a positive syphilis, I could definitely give that result over the phone and encourage them to come in for treatment. So I think the blood drawing part of that job was so necessary for it to function. I just think that not everyone was willing to come to our clinic and wait in the waiting room and take a number. That's not everyone's style. They're like, if you want me to do it, you can do it right here. I'm like, all right, let me get my kit. And it was nerve-wracking sometimes. I didn't want to hurt anyone. I didn't want to mess up, but I was successful more times than not. So I'm happy about that.
That's really awesome, and it really shows like meeting the community where they're at, and I think like just building off of that initial experience that you had as a summer research institute fellow, where you were meeting people where they're at to kind of hear their perceptions, and now you're in a place where you're meeting people where they're at and getting helping them to get tested and then providing resources and other supports that they might need. And I think this is very, very important and pivotal work in public health, and like the harm reduction and importance of serving people, especially people that are suffering with substance misuse issues, really getting them where they're at to help and support them is a key and fundamental thing that we have to continue to do in public health. And I think that is one of the downfalls in public health, I think, as a system, is that we haven't set up enough harm reduction spaces that have syringe exchanges and other ways to just give this information to people consistently. And it's hard, especially with the types of populations where they're very transient. But yeah, I appreciate the work that you're doing, and I know there's
Thank
a
you.
lot more that needs to be done. But shout out to you, drawing blood in your car and stuff like that. That's pretty insane, pretty insane. But
Absolutely.
love to hear it, and as well as I think shout out to the organization that you said that helps with the of continuation of services for people, inmate populations, which I think is also important, as their populations, as we already said, they are overlooked. So yeah. So you also took part of this course, which is a non-credit course in epidemiology and public health practice, non-credit specialization at Johns Hopkins Bloomberg School of Public Health. So tell us, what was that that thought process of wanting to take this course, and then what did you learn from it?
Absolutely. So I was interested in changing jobs, and I realized that I wanted to continue my education in some capacity. I thought that that would help me determine what type of job I was looking for. And of course, I thought that would strengthen my resume. Going back to college for a master's degree was not financially feasible for me at the time, but with the internet and everything, you don't have to limit your education just to colleges and degree programs. So I did some Googling, like what type of epidemiology course could I take that would kind of strengthen what I'd learned during my degree, that would kind of show potential employers, like, I'm a lifelong learner. I will find a way to learn new things and to, continue adding value wherever I am, even if that means, taking an online course, even if that means I can't go back and get my MPH immediately. And of course, I mean, Johns Hopkins, Bloomberg School of Public Health, it's a very reputable school. And to have access to it as an online non credit course was awesome to me. So the platform that I took the course on was called Coursera, and they offer tons of different courses from all different types of institutions. So what I learned in the course, it really just honed in on the basic principles of epidemiology, setting up a surveillance system. What are like the key data indicators that show the health of a population or the morbidity of a population? Also talked about, global health trends and, evaluating programs and evaluating data systems to see if they're, effectively capturing what we need. So that course was absolutely essential for me to kind of, again, just continue my education and not have, oh, I can't afford to go get an MPH right now, be a barrier to my learning. It didn't have to be. This was really affordable, and they actually charged by the month. So it motivated me to get it done quick and to really, absorb the information so that I had to pay less money. So I would recommend it to anyone, that course or a similar course. I would recommend it to anyone who, wants to continue their education, but maybe doesn't want to spring for the next degree. Or maybe you already have your MPH and you're looking to kind of pivot into something else. And, maybe having this under your belt could kind of support, this new path that you're taking. I think it's great for anyone at any level. But for me, it was really good to reinforce those epi topics and also to kind of access education at a more affordable price point.
Love it. And I think that intentionality in knowing, okay, yes, I want to learn more, I want to gain this skill set, but I'm not ready to financially invest, time invest, whatever the case might be, to invest into Masters of Public Health, but realizing that there's still ways for you to gain knowledge and to show that you're growing and building skill sets that you can apply to the field, as well as you can still make an impact as someone with a bachelor's degree in public health, which I think is very important, because too many people out here do not think that is the case, but you definitely can. And I think, like, to that point, is you can get that bachelor's degree and build off of that the other skill sets, whether that's a certificate in phlebotomy or a non credit course with Johns Hopkins or any other public health school. Just knowing that there are ways for you to do that. So that's awesome, and I'm glad that you were able to do that. And you alluded to it earlier. So when you were in the position of a prison liaison, you said that you realized that there were these infection preventionists at the jail. You currently work as an infection control practitioner at Thomas Jefferson University Hospitals. Tell us about the connection between those stories, and then how you came across your current role and what you do in it.
Absolutely. So, like I said previously, I went to the prisons once a week. But prior to my in person visit to the prison, I had to be prepared. I had to know everyone's treatment date, have their medical records available to me. So prior to physically going to the prison, I would call the infection preventionist. Her name was Sharon. Shout out to Sharon. You inspired me. So I would discuss with Sharon, the patient's lab work, their treatment plan, everything like that, so that when I went up to the jail to meet the patient, I was ready to go with all the information I needed. And, she had quite a unique role as an infection preventionist in prison health, because that's just such like a niche topic. And again, with inmates, prisoners being an underserved, overlooked population, I really admire her for using her nursing background, to be an infection preventionist in the prisons. So as we got to know each other a bit, just from talking every week about, penicillin, um, I asked her, like, how did you get into this field? And she said, primarily it's nurses who get into this field. It's kind of something that some nurses do towards the end of their clinical careers because it's, more hands off. Infection preventionists don't treat patients or anything like that. And she told me that, there's plenty of opportunities in hospitals for infection preventionists. And that just blew my mind. So I did quite a bit of Googling, and I realized I was like sort of qualified to be an infection preventionist. And I thought, wow, what an interesting way to kind of scale down my work. It's like I went from my population that I'm concerned with being anyone with a Philadelphia zip code, well, that's millions of people, versus my population now is anyone who comes to Jefferson Health, central region. So I applied to a few infection control jobs, and a lot of them want either a registered nurse, which I am not. So for some of those jobs, I just didn't even apply. But a lot of the newer infection control programs, or I should say hospitals who are kind of open to that interdisciplinary collaboration, they'll hire a public health person, typically someone with an MPH. They'll hire a lab technician, someone with microbiology experience. They'll hire a public health person. So I was able to kind of get in at a good time. So I got my job at Jefferson as an infection control practitioner in 2021, like coming off of the great resignation. Everyone was quitting their jobs. My department had some vacancies. And in preparation for this job is when I took that course, because I knew they would want to see a demonstrated interest in epi, which, if you know about public health and you see that someone has a degree in public health, you would assume that they're interested in epi. But I didn't want to depend on them just seeing my BS in public health. So the hiring manager actually told me, like, we were impressed that you took this course, separate from just your college degree. And it really demonstrated that you are interested and have, the capacity to do a job to do with infectious diseases. So I interviewed, it went really well. And, I was lucky enough to be asked to be part of their team, and it's been great so far. I've been working in all different types of settings, from operating rooms to inpatient units, including medical ICU, everything from outpatient practices. There's over 70 outpatient practices that I deal with. I get a little piece of like the regulatory side of things. So, we prepare for Department of Health visits and their requests. So, I'm kind of on the other end of it now. Like, I used to call Jefferson Infection Control all the time when I was a DIS because my patients went there for care. So, meeting Sharon and kind of applying and getting the job, it kind of just like brought everything full circle. And I made the pivot that I never thought I would make. And I left public health after 2 years to work in healthcare. And I'm just so glad that I stuck to my mission and I remained open minded and flexible. Like, if I wasn't open minded, this opportunity would have passed me by. I would have said, "Oh, that's cool, Sharon. You do this amazing job within the prisons that I would love to do in a different setting, but it's not public health directly, so I don't want it." No, I allowed myself to kind of color outside the lines, if you will. And that's kind of how I plan on handling my career moving forward. I mean, public health will always be my central focus. And, I may go back to working in a more traditional public health role someday. I won't rule that out. But it's interesting to me that, working in public health and working at the Philadelphia Department of Public Health was such a dream for me. I thought once I got there, I would stay for 20 years. That's not how the world works, especially these days for us younger generations just coming up. So I've been able to like synthesize information that I've learned in school, in the online course, at my old job, at STD, and just bringing it all together and seeing how it's valuable in this healthcare setting has just been amazing. Like they like to hear my perspective as like the public health person on the team. It's just fascinating.
That is awesome to hear, and I think like just highlights the importance of saying that you want this type of role, realizing that I can do this course and I can use something to both build the skill set and understanding of the role, but also demonstrate that I'm someone that wants to learn. And like I think gets to that point is that the hiring manager said, this stood out to me. Like, we're impressed that you did this. And I think that's important for people to do is like, what can I do to go above and beyond what is just typical or the average? And to your point, like this was something that you were able to get done in less than a month. So there are ways for you to build your skill set and build yourself as a professional. So I just think it's so important to not discount yourself and really figure out what you want to do and make those moves to do it. So that's awesome.
Thank you.
Yeah, and then as you were kind of alluded to, like what before I move you on to the last part of this
Hmm.
show, I'd like to know, where would you like to see yourself in the future, Marissa?
Yeah, that's a great question. So I've really enjoyed my work in the outpatient setting. As we all are probably aware, healthcare is moving from a more inpatient model. You have to stay overnight to get care or to get surgeries, to a more outpatient model. More and more invasive procedures are happening in the outpatient setting. And infection preventionists can help to prevent, you know, healthcare associated infections in that outpatient population through a variety of ways, rounding, etc. So, through that experience in the outpatient world and seeing the inner workings, especially in my particular situation where I'm working with hospital based practices, meaning that they are outpatient clinics that actually operate under the license of the hospital, meaning that they have hospital standards in an outpatient setting. So, my experience in working with outpatient, I think that that may be a path that I take, maybe working in like operations for outpatient or something of the sort, to kind of bring that infection control and public health perspective into, the operation side of things, the kind of behind the scenes of how outpatient clinics run. And again, I think it's so important because healthcare is moving more in that outpatient direction, that there will be a need in the future for, individuals to ensure quality and things of that nature in outpatient. I also see myself traveling a lot. I went to Mexico last year and it absolutely blew my mind. I had the best time. And, I'd like to continue traveling. Um, and I see myself happy in the future. I hope I have a full life of balance with career, family, friends, everything else. I also see myself continuing to kind of reach up and down at the same time. I think, regardless of whatever phase of my career or my life that I'm in, I will continue to seek out the guidance of those smarter and more experienced than I, and I will continue to offer advice or help to those, starting out or who have less experience than I. So I think that kind of like energy flow will help me, to achieve my personal version of success, which is being able to shoot for the stars for myself, be fearless in asking for opportunities, like sending you an email, asking you to be on this podcast. And then also, helping early career professionals or even college students with any issues they may have. Because I think, too, as a first generation college graduate, I totally see the value of those type of connections. I mean, like I said before, those type of connections with people have helped me in huge ways. So I definitely still see myself being a mentor as I progress in the future. And I still see myself, reaching out for help too.
Love it, and I appreciate you like just mentioning all the aspects of life, because say it way too many times, but can't oversee it, is that you are more than your career, you're more than your job. There's so much more to life. So
I
just being
couldn't
able
agree more
to
with that.
yeah, so just being able to appreciate all those different aspects and being able to grow in all those aspects, I think is very, very important. So I appreciate that perspective, and we look forward to seeing where you go in the future. And
Thanks.
happy that you were able to come on the podcast and share your experiences.
Thank you.
Yeah. So moving on to the Furious Five, the five questions that we
Yes.
ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Okay. Advice I would give is to look for public health all around you. Public health doesn't have to just be a job at your local health department, although that is a great route to take, of course. Public health exists in all industries, in all realms of our society. So maybe you have an interest in public health, but you're financially savvy, or you have an interest in public health and you're really into history and anthropology and people. All of that is valid. There's room for you in this field. Don't think you have to go the traditional route to succeed in this field. I love the field of public health, but I did leave traditional public health after 2 years. Keep your eyes open, stay flexible.
Great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Sure. So I would say reach out to infection preventionists on LinkedIn, reach out to me, reach out to people who can give you some advice on what looks good on an application. In addition to that, like networking piece of learning from people smarter and more experienced than yourself, I would also say to pursue more education, even if going back for another degree is not feasible, whether that's, a non credit course like I took via Coursera, whether that's, auditing courses at a college where you kind of sit in, but you're not like technically a student. Explore options to continue your education. For some people, that might be like a coding certificate from Google. Get creative. Education doesn't just exist at universities.
Absolutely. And the public health landscape is ever changing. So just try to stay in front of it. Number three, what's something you're working on improving in your life right now?
Yes, I'm working on improving my sense of balance. I think the pandemic was kind of a hard reset for a lot of us, especially those of us who are dedicated to full time careers in any industry. It's not easy, trading 40 hours or more a week of your life to a job. So I've just been working on balancing working really hard at my job and like reaching for success while also taking time off because I'm lucky enough to have time off through my job to travel, spend time with family, friends, significant other, just creating a life that I don't need to like escape from. Even though work can be hard or challenges with family, all of that can be hard. Having that really good sense of balance, I think, is something that I'm striving towards.
Love it. Number four, professionally, do you recommend anything?
Absolutely. So, to do with the acceptability piece we discussed earlier about, we want public health programs not only to be accessible to individuals, but also acceptable via their cultural standards, etc. I would recommend this book to anyone listening. It's called The Spirit Catches You and You Fall Down, and the author is Anne Fadiman. Basically, this book is about a young girl in a Hmong community in California, and she has a disease. And it's a bit perplexing to her medical team the way that her family accepts or doesn't accept certain medical interventions per their culture and religious beliefs. I think this book is absolutely essential for understanding cultural competency, for and its importance, of course, understanding like what acceptability really means, and also just understanding that there are barriers to people accepting what we may or may not have to offer them, but we still need to get creative and support them, in their journey for health. So definitely recommend that book. Again, it's called The Spirit Catches You and You Fall Down. The author is Anne Fadiman. And then I have two social media recommendations as well. The first one is on Instagram. Her name is at her first 100K. It is Tori Dunlap is her name. She is the owner of the platform, and her first 100K, they focus on, women being their target audience, but it's for everyone. And they focus on financial literacy, resume writing, leveling up your career. I'm really interested in that stuff too, like not just to do with public health, but just like in general, helping with your career stuff. So her first 100K is great. And also another social media, it's on Instagram. It's called at Financed, and it's Sania El Amin. And she's a creator in the personal finance space as well, similar to Tori Dunlap. She gives really great advice on pivoting careers. And one of the things she talks about is transferable skills. So, how someone with a what we would consider to be maybe like an everyday job, like a teacher or, a similar job to that, how someone in that industry can identify their transferable skills to then pivot into a higher paying industry. So, Sania's page is great for anything to do with career, finance, travel. She's amazing. So, I would encourage all of you to check them out and give them a follow if you're interested.
Awesome. Well, I appreciate you sharing those, and I will be sure to link them in the show notes for anyone that is interested. And I think very, very important to highlight like that financial piece. And there's more to life than public health once again.
Yes.
But moving you on, last but not least, where can people connect with you, Marissa?
Absolutely. So I'm Marissa Leahy on LinkedIn. It's a black and white photo of me smiling. And my email, I'll give it to Amari as well, but my email is marissaalanaleahy@gmail.com. Please feel free to friend me on LinkedIn, send me a message, or shoot me an email. I'm happy to chat with anyone who has questions or comments for me.
Awesome. I'll be sure to link that in the show notes for anyone that is interested in connecting with Marissa. But thank you so much for coming on and sharing your story, sharing your insights and your perspective. Definitely, definitely very valuable, and I appreciate it.
Thanks for having me, Amari. I really appreciate it. This was awesome.
It is my pleasure indeed. So, housekeeping items, everyone. Thank you all so much for watching and listening to this. Be sure to subscribe if you have not as yet. Leave a like if you're watching it on YouTube. Leave a review and share it with a friend. That really helps to get it out to more people. So, subscribe, review, and share it with a friend. Appreciate you all. Peace.